On February 17th, Senator Barbara Mikulski visited Howard County to chair a Senate field hearing for the Health, Education, and Labor Committee.
Today, what I'm kicking off, for me, is my innovation tour. I want to travel the state of Maryland to see what are the best ideas that we can take back to Washington. I chose Howard County to kick this off because of the bold vision of our county executive, Ken Ullman, and his very able and intrepid, unflinching and unflagging health commissioner, Dr. Peter Billiamson. In October a year ago, both Mr. Ullman and Dr. Billiamson shared with us the Howard County dream, which was to make sure that everyone in Howard County who did not have adequate health care would have it. That's pretty bold.
Joined by Congressman Sarbanes and Howard County Executive Ullman, the hearing explored successes and lessons learned from the Healthy Howard Access Plan.
The economic security of so many Americans is dependent on their health care situation. So if we want to address that situation, we have to keep moving on health care reform.
We believe here in Howard County that health care is both a right and a responsibility. And toward that end, last year we announced the Healthy Howard Access Plan, becoming one of only 2 jurisdictions in the nation with a plan to provide affordable access to health care and comprehensive wellness, prevention, and health coaching for all uninsured individuals, and the only to do it without any mandates on businesses. I believe that most businesses who do not offer health insurance to their employees want to but simply can't afford the ever-escalating cost of health care. We must remember that of the approximately 20,000 of our neighbors here in Howard County who do not have health insurance, of course we've whittled down that number since, 85% are from working families.
A key issue addressed was uncompensated care, a concept Senator Mikulski described as a myth.
Maryland's the only state in the United States with an all-payer hospital system, meaning that every hospital is required to treat every patient who comes through their doors, no matter whether they have insurance or not. The state sets the rate that the hospital can charge for every procedure a little bit higher, and that extra premium is set aside in a fund so the hospital can cover the cost of care for the uninsured patient who cannot pay. Every Maryland family with health insurance pays approximately $1,070 per year in this hidden health care tax. We believe that through our Healthy Howard Access Plan, we can and are driving down this cost by getting folks the care they need when they need it, by providing access to primary and preventative care, specialist care, prescription drugs, as well as personalized health coaching. Every Access Plan member is matched with a health coach to help them formulate a health action plan and take steps toward achieving their health goals. This will lead, and is leading, to improved quality of life and decreasing the risk of future disease development.
Healthy Howard Access Plan addresses the problems of the uninsured using a multifaceted approach.
We don't know of any other program in the country that has all the components that we put together: primary care, prescription drug, hospital, specialist, and personalized health coaching. The health coaching happens face-to-face, not a phone call, as is often done by insurance companies managing chronic disease folks, where a nurse will call you from Nashua, New Hampshire, or here in Baltimore to see, or Columbia, if you have taken your diabetic medication. And no, here, our health coaches will go to meet folks face-to-face, help them in concert with their primary care physician to develop a health action plan which will help to keep them as well as possible. Sophia Institute, which I know the Senator is particularly interested in, we won a grant from the Horizon Foundation, and they're training our health coaches in integrative medicine and wellness and ways in which to motivate patients as well. That's one large aspect of what we're doing. Our first patients have been seen starting in early January. We've now had dozens seeing their primary care docs, and our first patients are now meeting with their health coach to come up with their health action plan.
If you could sit down to talk with members of Congress, what would you do to tell us about what we needed to keep, what's your must-do list, and what you would work on improving?
Number one, clearly, as the county executive was mentioning earlier, through our efforts through the comptroller being able to reach out to eligible parents of kids with CHIP to get their children enrolled in CHIP, we sent out 20,000 letters or so at a cost of several thousand dollars, only several thousand dollars, and got 1,200 hits in the first 2 to 3 weeks. That, combined with our enrollment efforts for Healthy Howard, whereas the county executive mentioned, able to reduce in a very, very short period of time by over 10% the number of uninsured people living in Howard County. We think that this highlights the issue that has been shown through many studies, that about 25 or 30% of all people who are uninsured in this country actually are eligible for existing programs but either don't know it or haven't applied, and with relatively easy, in a relatively short time frame and relatively insignificant resources, be able to knock down the number of uninsured from 50 million in this country with the economic recession right now to probably into the low 30 millions. Not solving the problem, but clearly making a significant dent. The second thing that's applicable or replicable is this program in itself. We don't want to see 3,500 iterations of different counties doing these programs. However, putting together a network like we have done here in Howard County is certainly doable in some form or fashion in many counties, even many urban and rural areas.
The IT infrastructure for Healthy Howard was created using the 1E app platform.
It is an online screening tool connecting families and individuals with benefits for which they're eligible. In Howard County, the system is called Healthy Link, and in Howard County, it currently provides eligibility assistance for Medicaid, Healthy Howard, M-CHIP, your S-CHIP program, and the Kaiser Bridge program. And it generates applications, it stores data and documents, it tracks applications, it allows for the selection of a primary care provider, dental providers, and it uses kind of a TurboTax approach to helping families connect to the benefits for which they're eligible. It was implemented in Howard County to improve the efficiency and generate high-quality applications, ultimately getting the families and individuals in the right program, the program for which they're actually eligible.
Another key point was the program's fresh approach to the enrollment process.
Commend the leadership in Howard County for stepping out boldly, as you point out, Senator, on both the coverage design front, but also really taking a look at the way in which families connect to benefits and trying to make that process more rational for the families who more often than not find themselves being referred from one location to another, filling out the same forms, writing the same information again and again and again. It's an irrational way to do business, both from the consumer perspective as well as from an administrative perspective, because at some point all of those paper forms have to be manually data entered into a system.
Critics of the program say it's an expensive infrastructure for a small number of initial enrollees.
The lessons that I think we've learned are that there's a lot of people who are eligible for existing programs. And we knew that, as Dr. Bielenson said, but to see how many people, like the story where you've got into something that your son was eligible for, that you were eligible for, that for a variety of reasons, your experience with DSS, you just weren't getting. I mean, this is something that Senator, through her leadership at the national level, has provided funding for, has provided opportunities for, and it's just not getting to you. And so that's been a huge lesson for us, and it's buffeted, sort of our belief that there are folks who are eligible for existing programs. And to me, that's one of the most exciting pieces. I think the one pitfall, if you will, is how hard it is to find people. People are busy. We've got a first wave. I mean,
How hard to find people to do what? To participate in the program?
You read the paper and you heard a radio interview and you heard about us and you checked us off on your list. Well, there are thousands of people like you who still don't know that we exist. And so that's, I think, that the toughest lesson for us is how do we reach that next group of people that are working two jobs and are busy, and because we know this is working, and so we want as many people. We want to hear this story for the thousands of people who don't have health care.
Unique to the Healthy Howard program is the concept of the health coach.
The health coach is the center of their care universe, who will make referrals as need be, but will follow up if they need a program. A nutrition program, they'll call a community resource coordinator who will find such a thing.
Both Senator Mikulski and Congressman Sarbanes recognized Healthy Howard as a model program that could be scaled up to a national level.
First of all, you didn't have to do this. You really did not have to do it.
Thank you.
Nobody would have noticed if you didn't do it, but you decided to do it anyway.
This is quality. This is what quality is all about. It's a culture of patient-centered care. It's providing a continuum of care, because at the end of the day, it has to be about people, not about insurance, not about technology, not about trying to shoehorn yourself in.